Learning to protect yourself on the job against blood and bodily fluid spills is vitally important. That's because blood, whether it's dry or not, can carry disease-causing germs, also known as pathogens. The term bloodborne pathogens describes the microorganisms present in human blood that can cause disease in humans. Safe work practices can protect you from bloodborne pathogens if you apply the practices correctly and consistently. It's important to note that most bloodborne diseases are contracted or caught outside the workplace. In fact, about 95% of all bloodborne infections are due to high-risk behaviors, such as unprotected sex with an infected partner or through shared needles and drug use, and not through occupational exposure. Bloodborne pathogens have been found in blood and in certain human body fluids, as well as on materials, objects, or surfaces that have been contaminated with blood or those specific bodily fluids. Human body fluids that could be potentially infectious include semen, vaginal secretions, spinal fluid, fluid around the lungs, fluid in the abdomen, fluid around the fetus, fluid in the bone joints, any bodily fluid contaminated with blood, any bodily fluid that can't be identified. In addition, any unfixed organ or tissue is also considered potentially infectious. You'll hear these human bodily fluids referred to throughout this training as other potentially infectious materials. Whenever human blood or these body fluids are encountered, it is important that you treat them as if they are known to be infected with bloodborne pathogens. That's because you cannot tell by looking at them whether they are infectious and because the origin of the fluids is often unknown. There are some body fluids that are not considered to be at risk for transmitting a bloodborne disease, unless they are visibly contaminated with blood. These fluids: saliva, nasal secretions, urine, feces, sweat, tears, vomit. It is important to note, however, that these bodily substances can transmit other infections and diseases. Human diseases transmitted by bloodborne pathogens include hepatitis B virus, known as HBV, the human immunodeficiency virus, known as HIV, malaria, hepatitis C virus, syphilis, and others. The hepatitis B virus, or HBV, is a hardy virus that infects the liver and may cause liver damage, liver cancer, and even death as hundreds of people die each year from this virus. 1 teaspoon of HBV-infected blood can contain over 1 billion HBV particles. HBV can remain alive and infectious for up to 10 days, even in dried blood. After exposure, it can take 2 to 6 months for the virus to develop. This means that vaccinations started immediately after exposure can reduce the possibility of infection. HBV symptoms include fatigue, mild fever, muscle or joint aches, nausea, vomiting, loss of appetite, vague abdominal pain, and diarrhea. Some patients notice dark urine and a yellowing in the eyes or skin. In some cases, infection may not be apparent. Most cases of HBV contracted through work-related activities involve medical personnel who routinely handle sharp objects or needles. These sharp objects are often referred to as sharps. Most HBV infections are not recognized or diagnosed because symptoms are mild. Although there is no cure at this time, a vaccine can reduce the possibility of exposure. The HBV vaccine is a non-infectious yeast-based vaccine and is not from virus particles. The vaccine is effective about 95% of the time when given before infection. The vaccine is given in a series of 3 injections and is effective for at least 10 years. The HBV vaccine is available at no cost to all employees who may have occupational exposure to bloodborne pathogens. There is an alternative vaccine available for people who are allergic to yeast. The human immunodeficiency virus, or HIV, attacks the body's immune system, which will eventually weaken to the point of succumbing to other infections, which are not normally fatal at the time a person is said to have AIDS. AIDS will eventually cause death. 1 teaspoon of HIV-infected blood contains about 15 HIV particles. The HIV virus will not usually survive for more than a few minutes when exposed to room temperature air, but may survive for hours in liquid. In the last 10 years, less than 100 workers across the country have been infected with HIV due to occupational exposure. Most of these infections were due to accidental needle sticks. HIV symptoms include loss of appetite, diarrhea, weight loss, bruising easy, skin lesions, shortness of breath, fatigue, dry cough, night sweats, fever, a white film on the mouth or tongue, and swollen lymph glands. HIV symptoms may not appear for many months or even years, and it may take years for the infection to be diagnosed. No cure is available at this time, and there is no preventative vaccine. Occupational exposure occurs if some or all of your job duties expose you to human blood or other potentially infectious materials. This means reasonably anticipated skin, eye, or mucous membrane contact with blood or other potentially infectious material, or any infectious material and objects that could cut or pierce the skin. There are other ways to protect yourself from contracting these diseases in the workplace. Let's look at some of the practices you can use while on the job. Taking universal precautions means that you treat all human blood and body fluids and all unknown spills as if they were known to be infected with HIV, HBV, or other bloodborne pathogens. Universal precautions mean that you minimize the possibility of any contact with skin or mucous membranes by using full personal protective equipment, as the occupational exposures requires, and following prescribed practices when coming in contact with a spill. Personal protective equipment, or PPE, will be provided for you and must be used, whether you are working with cleaning products, cleaning up blood, or any other unknown body fluid spill. Personal protective equipment is not optional and is a regular part of the job. Failure to wear appropriate protective equipment could result in disciplinary action. Personal protective equipment includes gloves, gowns, aprons, coveralls, face shields or masks, and eye protection. Employees must wear appropriate personal protective equipment for the type of occupational exposure that can be reasonably anticipated during the normal performance of their jobs. All personal protective equipment should be removed before leaving the work area and placed in an appropriately designed area or container. Gloves should be worn whenever potentially contaminated items or services must be touched or when service master policies direct. There are 2 types of gloves: reusable and disposable. Disposable gloves are single-use gloves that must be disposed of after each use. Reusable gloves can be decontaminated and used again, and must be carefully checked for punctures or tears after each use and after decontamination. Both types of gloves must be replaced when they are torn, punctured, or when they no longer provide a sufficient barrier. For example, if you are sanitizing a bathroom and see spots from a bloody nose, do not clean the area without protecting your skin. With gloves on, you can clean and disinfect this area safely. Using a paper towel, clean the affected area following the CDC OSHA recommendations. After cleaning, discard the soiled paper towel in the appropriate container. The CDC, Center for Disease Control, and OSHA recommends when cleaning up human blood, human body fluid, or other potentially infectious materials to, first, clean up the area with a general cleaner or bleach solution. If you choose to use bleach, it should be mixed to a 1:10 bleach-water ratio. Next, disinfect the area with either a service master disinfectant or a bleach solution. The same precautions are necessary for emptying the trash. Gloves will ensure that if there happens to be a blood-soaked item present, the blood will not come in contact with your skin. Remember, universal precautions means that you handle any blood or other potentially infectious material as if it is contaminated. To prevent any exposure to blood or other potentially infectious materials, treat it as if it is contaminated. To reduce the chances of being cut or punctured, never compress trash with your hands. Always carry the trash bag from the top and away from your body. Depending on the degree of exposure, you may need to protect your face with protective goggles, glasses with solid side shields, masks or full face shields. Eye, nose, or mouth contamination may be possible around splashes, spray, spatter, drops of blood, or other potentially infectious materials. The risk or potential for exposure will determine the PPE that should be used to dispose of contamination. Your supervisor should know where this additional personal protective equipment is located. Work practice controls are predetermined cleaning procedures and practices. Let's take a look at some of the main ones. Hand washing facilities must be provided in all areas where there is a potential for contact with infectious materials. Employees must wash their hands immediately or soon as feasible after removing their gloves or other personal protective equipment when contamination has occurred. Employees must also wash their hands or any other exposed skin with soap and water, or flush mucous membranes such as eyes, mouth, etc. with water immediately following contact of those body parts with blood or other potentially infectious materials. Many facilities that carry a risk for exposure will also provide eye washing stations to use in the event your eyes are exposed to blood or other potentially contaminated materials. Precautions should be taken if improperly disposed sharps are found. You should follow your company's policy as it relates to sharps disposal. Needles and sharps should always be disposed of in appropriate containers. Report any needles or sharps found outside of sharps containers to both your supervisor and the customer. In work areas where there is a reasonable chance of exposure to bloodborne pathogens, never eat, drink, smoke, handle contact lenses, or apply cosmetics or lip balm. Engineering controls eliminate hazards at their source and eliminate or minimize employee exposures to blood or other potentially infectious materials. An example of an engineering control is a puncture-resistant container for needles. Such engineering controls are usually the responsibility of the facility to install and maintain. As a safety precaution, many of today's syringes have safety mechanisms built in. One such mechanism is the needle guard that is activated once the syringe has been used. Do not store food or drink in the refrigerators, freezers, cabinets, countertops, bench tops, or shelves where blood or any other potentially infectious material may be present. When handling blood or other potentially infectious materials, avoid splashing, spraying, or spattering. Do not handle or transport specimens or specimen containers of blood or other potentially infectious materials. Do not clean contaminated equipment unless you have had prior training on the proper procedures and precautions. Never transport infectious materials outside of the facility. Following prescribed cleaning practices is an important step in preventing infection or contamination from bloodborne pathogens. All surfaces which have been in contact with blood or other potentially infectious materials should be cleaned using proper personal protective equipment, primarily gloves. First, remove the blood or other potentially infectious material from the surface as if you would any other spill. Next, disinfect the area with a Service Master disinfectant. Use these products only according to label instructions. The disinfectant should be allowed to dwell on the contaminated surface for at least 10 minutes. Here are 2 examples of using this process. If you encounter blood or any unknown spill on a tile floor, put on gloves and other PPE as warranted. Blot up the spill with paper towels or any absorbent material. Remember that any disposable material used in the cleaning process must be disposed of in the regulated waste red bags. First, clean the surface with a general cleaner. Next, apply the disinfectant solution to the contaminated area. Allow the product to dwell 10 minutes. Remember that any tool used to clean up a potentially infectious spill must be decontaminated. Clean and disinfect all equipment and similar items intended for reuse. If you encounter such a spill on carpet, make sure you have gloves and other PPE needed to protect yourself from exposure. Thoroughly extract the carpet and apply carpet sanitizer to the contaminated area. Allow the product to dwell 10 minutes, then rinse extract. Broken glassware that may be contaminated should never be picked up directly with your hands. Instead, sweep it with a brush and dustpan or lift it with tongs. If in the course of your job you encounter a large blood spill or any large spill of potentially infectious material, contact your supervisor. Only employees specifically trained on spill containment of bloodborne pathogens should handle large spills. Regulated waste can potentially carry bloodborne pathogens. Regulated waste include semi- or semi-liquid blood, contaminated items that would release blood or other potentially infectious materials if compressed or squeezed, such as bandages or towels. Regulated waste also include items that are caked with dried blood or other potentially infectious materials and are capable of releasing pathogens during handling. The contamination should also be reported to the customer and appropriately logged into the communication logbook. Contaminated sharps are also considered to be regulated waste. Two items not generally considered to be regulated waste are discarded feminine hygiene products and bandages that do not contain flowable blood, since it is expected that these waste containers will be lined and emptied daily. Service master employees do not normally participate in loading or moving regulated waste containers. Regulated waste should be placed in proper containers and labeled or color-coded as required. These containers should not be opened, emptied, or cleaned manually or in any manner that would expose employees to sharps injury. If the container must be transported from the use area, they must be closed immediately before removal to prevent spilling. All regulated waste containers that might leak must be put into a secondary container and labeled or color-coded as required. Never transport these regulated waste